Hey, Monroe County Sheriff Todd Baxter here in Rochester, New York with another quick hit podcast. We're going to talk to some victims that we never really think about. And what we were just talking about off the air is how many times they were assaulted in emergency rooms. That's our local medical providers at our local EDs, our emergency departments, and got two wonderful nurses that save lives for a living. And we never think about you ladies being victimized, right? And we seen your story on the news, and I thought it was important that the public hears other forms of victims. And there's Erin walking with her. No more crutches?
No more crutches.
No more crutches. But you shouldn't, doing a job of saving lives, you shouldn't be the victim of a crime. So real quick, before we get into this and talk about, your field of influence as far as why you think, crime is unreported and why you think that it could be adjusted, our laws could be a little tougher and keep you safer and us safer. How about real quick about your history? Who are you and how long you've been doing this awesome work of nursing?
Well, I'm Dixie Kendall.
Thanks, Dixie.
And I've been a nurse for over 20 years.
Wow.
Been in the ER for 13 of them.
Yeah?
Yeah.
Yeah. That's ground zero of the medical profession, right?
It is.
That and the ambulance crew.
That's exactly right.
Yeah.
Yep. And I currently work at Clifton Springs in the ER with Erin. And we also have worked together in the past at Geneva.
Oh, really?
Yeah. We've got a long history together.
Awesome.
Known each other a long time.
Yeah.
That's awesome. And Erin?
So I've been a nurse for 7 years,
Okay.
ER the whole time,
Yep.
and same with Dixie. So we started working together. I was a tech actually in Geneva
were?
when we started working
Oh,
together.
I was
really?
her manager.
Oh, really?
She was. And then
A mentor, right?
Well,
Yeah,
yeah.
man.
I always look up to her, that's for
Aw.
sure. And then we were traveling for a while. Her contract wasn't working out, so I said, come to Clifton with me.
Uh-huh.
And
We're back
working
together.
That's awesome. And why nursing? Why ED nursing, right? I mean, there's a lot of fields of nurses, and why the emergency department?
I just have nurses and medical personnel in my family, so I just think I was just always kind of interested in it. I did a shadow with my cousin one day, and after that, I was like, that's what I'm gonna do. And then my sister was actually working in the ER, and she recruited me down, and I couldn't get away from it after that.
So my mom was a nurse,
Yep.
and that is all I can remember growing up. So I actually wanted to be a labor and delivery nurse.
Oh, really?
I've taken the path of LPN, then I got my RN, went to labor and delivery. Geneva closed the floor down, and I was like, cool, let's be an ER nurse.
That's awesome.
So
And the reason I asked that question is that it's a different form of being a registered nurse. I mean, you got the skill sets of all the RNs, but you're in ground zero. You never know what's walking through that door. You never know how many are walking through the door. You don't know how many victims, what type of victims, do they fall? Is it a catastrophic? Is it an assault?
You never know.
You deal with everything.
we do.
That's what we love, though.
Yeah,
Yeah.
That's what I thought.
The unknown.
The drive of helping people. So you guys were victims of crime. How about we can't talk too much about that for our public, only because you're prosecuting that case, and we never want to affect the discovery. And anything you say here could be brought in as discovery. But let's talk about being RNs, working in emergency rooms. How many times are you victims of crimes? Not this particular one, but how many times are you victims of crimes? I mean, is this one-off, or is this something that's...
I don't think I could even count.
Yeah. I mean, if you're even just talking about us individually, it's up there.
Yeah.
Yeah. I mean, are we talking verbal assault? Are we talking physical?
Physical. I mean, so in New York State, me slapping or pushing you and harassing you, it's called harassment. Now I cause a physical injury, that would be an assault. So how many times you slapped or pushed or spit upon or something that the average citizen would go, that annoyed and alarmed me, and
Countless.
countless.
I've been punched in the stomach, spit on, hit, slapped, pinched.
Right.
All of us. I mean, you talk to any healthcare worker, and we just don't do anything about it because we just keep going.
Keep going.
We accept it as part of the job.
Yeah.
Yeah. That's a profound statement.
Yeah.
Yeah.
So I always argue about stats, numbers, reported crime, and my politicians want to argue, crime's going down in New York State, crime's going down. Well, I don't care anyways, because if you've got one victim, our job is public safety, we're failing, right? So
Right.
I'll never accept that as an argument. Of these multiple times you guys have been harassed or assaulted, how many were reported to local law enforcement? How many go in our FBI database? Which
the
takes a
problem.
police officer to show up and write a report, right?
Little to none.
Little to none.
In 20 years, the first time I ever did it was last fall.
Really?
Yeah.
That's incredible.
Yeah.
In 20 years.
In 20 years.
And it happens all the time.
Happens all the time.
Yeah. And again, that's not against the employers or anything like that. It's just,
No.
that's across the board. We find that, we did a point in time survey here in Monroe County of 4 box stores. big box stores you know the names of, just 4 of them. They let us look at their loss, their unreported loss, $7.3 million in a little over 18 months. That was unreported theft to police officers and to law enforcement, right? So this whole unreported crime thing is real. And I thought your story was profound to share that.
I think that's what we're trying to do too, is we're trying to encourage people to go on paper.
Right.
Because we're always so busy at work, we don't have time to step away, to make a statement and to do this. And so when we do, it's serious.
Yeah.
But that's the problem, is it's so unreported. And, both of the people that we were victimized from have a long history.
Yeah.
And that's just the things that were reported, not the things that weren't reported.
Yeah, and again, every time we arrest someone, it doesn't mean that's the first time you committed a crime by any means. We're not that good at our job, or you commit a traffic violation, we catch you every time? Absolutely not, right? And by the time, same thing with larcenies and harassments. There's many reasons it's underreported, but the fact is it's underreported, and same thing with your profession. Listen, this is a quick hit podcast. I could probably talk to you guys all day long. I want to make sure I get one point across. You guys are superheroes. I truly believe that. I've been to the ED one too many times for myself and for victims of crime. And when you see the caregivers in there and the miracle workers, you save lives, literally incredible. So it's precious what you do. And I don't want to miss this moment while saying thank you for what you do. It's pretty cool. And we appreciate you. You shouldn't be victims of crime. And if you are, we should be able to prosecute that. But we also set culture. Unreported crime creates a culture in your ED. It creates a culture. You can do anything you want to in RNN, and no one's going to put you in handcuffs and take you to jail. And we know that creates a culture, right?
That's absolutely right.
Yeah, so it doesn't matter where you're fighting crime. It's all the same thing. But anything you want to add to the story of being an RN and being a victim of crime? Again, staying away from your particular case that's being prosecuted, but...
We kind of talk about that all the time, about how people come to the ER and then just act in ways that they might not act in public.
Yeah.
And it's just as soon as you walk through that door, and it's not just us, it's our patients. It's our mental health patients. It's our medical patients that are in danger because of these people. And that's when we're just like, enough's enough, because we're not just fighting for our safety. We're fighting for our patient's safety.
Yeah,
we're fighting, if someone, this affects everyone.
Right.
There's not a single person that hasn't had a medical emergency or has known someone that's had a medical emergency, and they need us. And when this happens, our resources are diverted.
Wow.
Everything is just kind of put on pause. And, this affects everyone.
The other patients are suffering too.
This affects everyone.
Yeah.
That's what I was going to say. She hit it perfect because exactly.
Well, she had a good mentor, that's why.
There you go. Because we got to keep them all safe.
Yeah.
Not just the one that's diverting the resources.
Thank you, guys. I so appreciate you sharing your perspective on this and your stories. And I'll just finish the way I started. Thank you for what you do. You save lives and you help people in their most dire points of their life. And they came there for a reason. And they deserve to be treated just like everybody else. And diverting these resources away because someone can't behave in an ED is not acceptable.
Thank you for having us, too.
Yeah,
Yes,
absolutely.
Thank you so much.
Well, God bless what you do. And
Thank you.
until next week, folks, we'll talk to you soon. Be safe.